1990s, researchers and clinicians noticed more teens were smoking marijuana, and there was not any good recommendation on how to help them. So they enlisted the Center for Substance Abuse Treatment in a study of 600 kids, and it was a randomized controlled clinical trial, and found the best treatments for substance abuse, for cannabis use disorder teenager, for teens that were having problems with cannabis. It's 5 or 12 sessions, and there's a manual for it that they developed. But something happened. They did all this work. They made a manual that any clinician can use. It's published by chestnut.org. It can be downloaded online. It's called Volume 1 of the CYT Cannabis Youth Treatment Series. Anyone can download it. Now, you have to be a therapist to really understand it, but lately I've been experimenting with getting ChatGPT to administer it by programming it in there so it can sort of learn how to do it, trying to train it to make it more accessible to people. Because here's the problem. Hardly anyone seems to know about this. I've been attempting to teach it to the child psychiatry fellows at the University of Hawaii in the psychiatry department, the child psychiatry trainings. And with other educators, I've given workshops
Like a Romer or whatever?
at national meetings like the American Academy of Child and Adolescent Psychiatry. We recently gave a talk at the American Psychiatric Association. It was a presidential lecture because the president this year was a big substance abuse guy. At the Directors of Psychiatric Residency training, we're developing a model curriculum for programs, how to train people to use it. So I've given this information at a number of national meetings. But it's very important for people to know that there's good treatments, and it comes either in a treatment of 5 sessions or 12 sessions. It comes in sort of a package of 5 sessions. The first 2 sessions work on something called motivational enhancement therapy. So that's where the therapist doesn't confront the teen. They don't say, hey, you have a problem. They sort of have a more neutral but supportive attitude where they might say, well, tell me what you like most about it, and tell me, then they might ask, what kind of problems does it cause, or what led you to be here? So they sort of start opening the door. They engage the teen. They're friendly. They're sort of let the teen know, hey, I'm in your corner. And they do something called increasing ambivalence about the marijuana. So they begin to suggest that maybe there could be some other things they could do to accomplish what the marijuana is doing. So the first 2 sessions are motivational enhancement. That means getting them off their position of how great the marijuana is to saying, you know, yeah, there might be a couple things about it that are causing me problems. And then the next 3 sessions are called cognitive behavioral therapy. They're skill building sessions. Things like how to refuse marijuana when you're with a group of friends. Very practical things, very easy to do.